Hello, everybody. This is Clark Schafer at Strategic QB Marketing, and today on the line with us, I have a very special guest, a friend of mine, Dr. Atha McNay of McNay Voth ADHD Services, and we're going to talk about a couple of different things. Atha, how are you doing today?
I'm well, Clark, and I'm glad that the rain has ceased for a little bit this afternoon.
We need it, but it is nice to see the sunshine come out, and it's definitely much better on my psyche anyway when the sun is shining.
And mine too.
Let me ask you this, Atha. I know a lot of people, when they think of the topic ADHD, if they know anything about it, they think of it as a male-only type condition. How far off base really is that thought?
Well, ADHD is no respecter of gender, but historically it has been considered a male disorder because that's when it was first studied, was in boys and males. And just to throw out a little fun piece of information, it's been studied since the late 1700s. So mostly the condition had to do with little boys who were wiggly in classes, or they didn't live up to their potential, they weren't showing their academic potential, and that's how it got. It was defined by those types of behaviors.
That makes sense. That makes sense because that's kind of how I heard about it, early on as well. But that is not really the case, especially when we start thinking about how it impacts women. And let's talk a little bit about that. What's some of the biggest misunderstandings in regards to the disorder in women?
Well, if we start with the woman, the female, in her adult years, the misunderstanding may be that she is depressed all the time just because she's a housewife, or a misunderstanding will be, well, she's doing the best she can. Maybe she is not living up to her potential, but that's not as not as much of a push. She may be a housewife that her house is disordered and people think she's lazy. And she may be, but she may be a person with ADHD.
How can you tell that? What do you? Are there some signs that you can tell that in either yourselves or other people you come across? You as an expert probably see it a lot easier than us lay people.
Well, yes. I think when I talk to women and they talk to me about their lifelong issues of disorganization and problems with time management, relationships for women, females with ADHD can be a very difficult situation in, marrying the right man or going with the right boyfriend or having the right life partner. And we find both male and female take risky behaviors, but women take a different type of risky behavior. And then they start to pay the price for it when they get older.
Gotcha. Well, how about some of the misunderstandings on the teenage girls? Is that a lot different than the adult woman?
I think that's when it starts to emerge. Often we call teenagers emerging adults and watch their parents turn bright blue from choking to death at the thought that they are emerging adults, but they are. And the teenage girl will have a different maybe set of friends if she's a person with ADHD than she would have if she was an ADHD person who's being treated, or a non-ADHD person. Often we see real struggles with academic problems in high school and college. Also, we see risky sex behaviors, and as with other people with ADHD, we might see risky behaviors with substances.
Okay. And what about even younger? When do you start seeing this kind of disorder maybe come out and manifest itself? Do you even see it in younger kids, elementary type school?
Yes, and I've had parents tell me that they start seeing behaviors in their children as young as 3 and 4 years of age. We didn't used to address that at that early of an age, but pediatricians now are looking at their life history from the very beginning. Often, when they're really young, parents are seeing hyper activity and hyper behaviors that are causing chaos at home or in preschool settings. And now then, little girls are not as prone to sit and just be quiet and compliant as they were all the years ago when I was in elementary school, but we continue to see that because little girls will have a very inattentive type of ADHD where their mind zones in and out. But because they're little girls, they've already been taught little girls behave in a certain way, they sit still in a certain way, and many times they may be a very bright young lady who is just not getting her needs met. She's having social problems already in the elementary school years because of the way ADHD affects her behaviors.
I got you. And let me ask you this, Atha, in regards to, I guess I've always heard treatment talked about like medical type treatments, meds, Ritalin, and other kind of drugs of the day. Are there other ways to go about this, and are there better ways to go about and do this?
Well, actually, research tells us if you use a bimodal approach, which is medicine and then some other alternative, that actually it helps the person with ADHD learn the skills they need to control their behaviors or to live up to their potential or to organize their time. At McNay and Voth, we don't advocate one way or the other about medication, but we are always prepared, I should say. We're prepared to share with others about alternatives. One of those is just so culturally relevant, and that is exercise. Exercise has been proven to be almost as effective as medication in some people because ADHD is such a personalized condition. It helps to stimulate those attention centers in the brain. Other people do need medication, and as we know, Ritalin is the one that gets the bad rap, but there are many stimulant medications of various types, and there are there's the non-stimulant Strattera, and they work on the body in a little bit different way. But we always recommend that people understand what medicine can do for them, what light therapy can do for them, sometimes just being out in the sunshine, and we can help them to understand what exercise and proper eating and those life issues that deal with all sorts of life can do to help with the condition ADHD. I just want to say at this point that here in our community, we have numerous very well qualified psychiatrists and physicians who can oversee medications, because maybe you don't know this, but one of the concerns people have is if my child with ADHD takes some sort of stimulant medication, they might end up becoming addicted to drugs when they get older. And research shows that it's exactly the opposite. That because first of all, stimulants or even Strattera have to be overseen very carefully by physicians and psychiatrists due to federal regulations and the level of the medication. So when that helps them individual control his or her ADHD symptoms, that individual is less likely to abuse drugs, and usually starts out with cigarettes at a very early age and then builds up to whatever's out there.
Did not know that. As far as McNay and Voth ADHD Services, what types of things do you guys have as resources to help either the adult woman or the kids of us parents that we can maybe engage in to help our kids or help ourselves?
Our main service is coaching, which is the cheerleader of life. Individuals can go to their psychologist or psychiatrist or to a counselor or a therapist. We don't claim to be a counseling or therapy session. And those individuals can give them help to a certain point, but they cannot walk along beside them. And two examples from what currently is happening here, I have a mother and a daughter who will be meeting with me together because both are persons with ADHD, and they will be working on some of the same life issues, like how do we get ourselves organized to get out the door in the morning? How do we handle these time management issues? What do we do about helping to keep our bedrooms neater? Another example is a very lovely, highly successful woman who called me and said, "Do you work with older women?" And I said, "Well, I am one, so let's let's see what you define as an older woman." But she was diagnosed later in life, and she's finding that it's difficult now that she's single again to keep her materials at home organized. And we actually made a home visit to help her begin to see ways that she could sort and organize materials at home because she has a big move coming. We have one-on-one sessions with people. We let people tell us, especially the women, because women are very quick to verbalize how they feel and what they're thinking and what they need. You know, what is a goal that you have for yourself? Okay, now let's talk about ways that you can meet that goal. Well, here's, in the conversation we come up with an idea. Now, how does that work for you? Because the answer is usually within the woman herself. It certainly doesn't come from me. I don't tell them what to do. And then that helps that individual say, this is doable for me. This is something that I know would work for me. And then she will receive several text messages from me throughout the week just to say, how's it going? What else can I do? How are you feeling today? Any of those types of things.
Interesting. As we wrap up, I've gotten your phone number and your website address on the screen right now so people know how to connect with you. But I guess my question would be, how would someone even understand or realize that they might have a need that you guys could help them with? What would be some of the things that you would make as a suggestion to parents or to an adult woman that they might see in themselves that would be a trigger that they should reach out and possibly connect with you?
For children, oftentimes they have a sense of being confused, not happy at school, not living up to their own potential. We know that these are more than likely average or higher intelligence. A little draggy. Parents may wonder why their child seems depressed. Adult women know they have dealt with depression for a long time. They may wonder, why am I not making the friends that I need to make? Or why cannot I not be successful in love? Or why am I working this dead-end job when I really would like to move ahead in a career? And when women or mothers call me about those issues, I invite them to come see me for a free session, and we discuss some of the life issues, the background. If the individual has not had an ADHD diagnosis, then we strongly recommend before they come back to us that they see either their physician or one of our very competent mental health professionals here in our community. And then we ask them to get back in touch with us and tell us what they've learned.
Gotcha. And as we wrap up, any other things that you think our viewers would need to know or should know in regards to just the disorder itself and being successful and being able to navigate those waters with a service like yourselves?
Persons with ADHD, statistically, the people who do the numbers game tell us that probably 70% of all persons with ADHD have what we call a comorbid or coexisting disorder in the way of anxiety or depression. Sometimes they have bipolar type behaviors, and those are real mental health issues. And anyone who's suffered with a true chemical depression knows that it just absolutely inhibits life functioning. So when people have gone through life, like one person I know, when his psychiatrist said, "How long have you been depressed?" he immediately said, "Oh, I was about 5. So, you know, when there's a lifelong issue, and I laugh like that because I want to also say that a lot of persons with ADHD, not only are they highly intelligent, so they're very witty. And, you know, when all of these pieces don't quite fit together, it is always behooves them to go see a mental health professional. And then if they need us to walk alongside with them as they're learning new skills, then we're here to do that.
I gotcha. And Atha, just as we close, what's the best way to get a hold of you, and the best way to maybe do that investigation, to get that hour session with you to even make the decision if it's a good match for somebody?
Well, the easiest way would be for them to go to our website at coachadhd.com, and there's a place for them to send us a message, and that message will get to me right away. Or they can call me at 655-9807, and I guess I should say the area code for that is 316. I receive phone calls many times from people who just have a general question about ADHD. They're not quite sure exactly which direction they want to take in life, but we answer questions. We are very much here to encourage the entire community, cities around us, and even states around us, so that people can know what this condition is and that it doesn't need to completely impair functioning.
Gotcha. Well, Atha, thank you so much for your time today, and the information you shared certainly very, very valuable, especially if someone sees the symptoms in themselves or in their kids. I encourage everybody to just reach out to McNay Voth ADHD Services. The numbers and the web address are below in the description of this video after we post it, so you can connect that way. And Atha, again, thanks for all your time today, and look forward to visiting with you soon again.
And Clark, I appreciate you visiting with us. Thank you very much.
All right. Well, take care, Atha.